market, there's already PDE4 topicals, and they have an antipruritic effect that occurs quite rapidly, actually after 4 days of administration. Their mechanism of action on reducing itch is not totally clear, although the company mentions that they work on cytokines. They may have actually a direct effect due to the rapid response of nerve fibers. We have also been using topicals that target ion channels in nerves that we compound, such as containing ketamine, lidocaine, and amitriptyline. But these drugs do not improve the eczema, but reduce the itch by targeting some of these ion channels that are in the nerves that are overactivated in atopic eczema. Going into more immune therapies that are systemic, a major key difference in our patients' quality of life, the patients with pruritus who suffered so severely itches, the use of IL-4, IL-13 antibody that clearly are game changers for patients. They again have a rapid response in early as 2 weeks of treatment. And now there are currently developments of other drugs, such as drugs that target the interleukin 31. Interleukin 31 is an itchy cytokine, a member of the Th2 pathway, and is reducing itch rapidly again in the first 2 weeks of treatment. However, this drug is yet not in the market. Other drugs that are in development that are very exciting are from the Janus kinase. These are small molecules that work on downstream of IL-31 and IL-4 and 13. They are, again, extremely rapidly effective for itch. However, due to the fact that there are less targeted treatments and affect a large pathway, and they are considered pan-T-cell inhibitors, they come with a bigger bag of adverse effects. But interestingly, the topicals, and there are several topicals in development of Janus kinase, could be very effective also for itch treatment in atopic eczema. In addition, there are some drugs that are neural inhibitors of itch that could work on reducing itch intensity in these patients. These are drugs that have been in the market but are not unique only for atopic eczema itch, but they reduce the itch, and particularly the combination of using drugs such as SNRI, mirtazapine, that can enable our patients to sleep better. A kappa and the opioid and immune antagonist inhaler that reduces itch by a spinal mechanism and possibly a brain mechanism. Again, they improve the quality of life of our patients, but they're not itch specific for atopic. As well as some of the GABAergic drugs such as gabapentin and pregabalin that we use for our patients, again, to reduce a key phenomena in atopic eczema is that neural sensitization. The nerves are overactivated, very sensitive to any changes, and by dumping the itch intensity there, we enable our patients to have less itch and less scratching, and the itch-scratch cycle is reduced.